barrier methods of contraception like condoms or vaginal diaphragms, they protect against sexual diseases and also against cervical cancer, which is caused by sexually transmitted viruses. So these are protective against cervical cancer. The first thing that we need to know about cervical cancer is to know the risk factors. That is, who are the women who develop cervical cancer and who might not develop. And the most important factor that increases the risk of cervical cancer is the sexual behavior. Women with multiple sexual partners, or those who initiate sexual activity at an early age, or those with partners who indulge in risky sexual behavior, these are the women more prone to develop cervical cancer. And these are also the women who develop sexually transmitted diseases. So cervical cancer and sexually transmitted diseases go hand in hand. Next comes the smoking risk. There is increase in smoking amongst women, and this leads to decreased immune status, thus increasing the risk for cervical cancer. OCPs or oral contraceptive pill use has been shown to temporarily increase risk of cervical cancer, though this is just temporary and it reverts back to normal once the pill is stopped. And other immunodeficient states like HIV or transplant patients, they have high risk of developing cervical cancer. There is one protective factor which gives protection against cervical cancer, and it is the use of cervical diaphragms or condoms during sexual activity. This also protects against other sexual diseases.